Today we'll discuss a few key policies of the Baptist Health System in regard to OB patients and the special situation of Mission Trail Baptist, which does not have obstetric or gynecologic services. Baptist Health System has a policy that all pregnant patients greater than 20 weeks gestation with possible rupture of membranes or labor will be taken to labor and delivery for evaluation. They may subsequently be returned to the ED for evaluation of non-labor related problems. At St. Luke's, the first evaluation may include the ED physician seeing them before they go to labor and delivery. At the other hospitals, these patients generally will go straight to labor and delivery. This is regardless of whether their OB doctor goes to the hospital where they are or not. If a patient needs to stay in the emergency department who's greater than 20 weeks pregnant for stabilization or treatment, and they have the possibility of having labor or rupture of membranes, we should contact labor and delivery to send personnel to begin monitoring of the fetus and for contractions. They will then communicate these findings to the obstetrician on call. This is a infrequently used policy, so if you have any problems with this, please let your medical director know so that we can address it. Now, Mission Trails Baptist has no gynecologic or obstetric services available. So they've developed what's called an obstetrics alert. So this is for all pregnant patients that are greater than or equal to 20 weeks gestation who may have a pregnancy-related problem, including rupture of membranes, a previa, or they may be in labor or have had trauma and need further monitoring. This alert is not for patients that are 20 weeks or greater who have a medical problem only, such as asthma or a skin infection. Regardless, no obstetric patients of any gestational age can be admitted at Mission Trail Baptist. So for patients that are 20 weeks or greater who may have labor, rupture of membranes, need fetal topographic monitoring, these should have the OB alert called. For patients of any gestational age who need admission but do not have these things, then we should go through Access Baptist to determine the most appropriate place for transfer. A key point of EMTALA is that patients who may be in labor cannot be transferred if the sending physician believes that there is a chance that they could deliver en route, or if that transferring would pose a threat to the mother or child. We should still activate the obstetrics alert because this will bring neonatal and OB services from North Central to help us with these patients. However, we should not transfer them if we believe that they will have a precipitous delivery en route. If a precipitous delivery is suspected, the patient should be delivered at Mission Trail prior to transfer. So we activate the OB alert by contacting Access Baptist and telling them we have an obstetrics alert. This will key an automatic acceptance at North Central Baptist for the patient. Access Baptist will then allow a doc-to-doc between the obstetrician and the emergency physicians. All of these patients should go by ground transport to allow the team from North Central to take them. Again, Access Baptist will connect the ED physician and the obstetrician. We should have the patient evaluated prior to discussing with them to assess for such things as cervical os opening, fetal heart tones, bleeding or no bleeding. If the patient is going to deliver, we should still call the OB alert And we should call the OB alert as soon as we have a patient we think may be qualified to allow the transport team to start to come to help us. A couple more key things about the obstetrics alert. All patients go to North Central, and this is regardless of where their OB goes. And we should activate it as soon as we anticipate that the patient is greater than 20 weeks and will need fetotocographic monitoring or delivery.